Hi, I'm Dr. Craig Herre. I'm a co-founder of the Texas Center for Occlusal Studies. This December 7th and 8th of this year, we're having a sleep and airway continuum here in Dallas that's going to have some amazing speakers. If you haven't already noticed, airway has become a very big part of dentistry, especially those of us that treat the entire system and work with patients who have TMD and occlusal issues. We're now realizing that the health of the airway and the ability for our patients to breathe has a profound effect of their overall well-being. We realize that the airway and the lack of an airway is the genesis of a lot of the dental conditions that we see daily. Tooth wear, coughing, tooth grinding, swallowing difficulties, people with GERD. These types of things are all related to an airway problem. It also causes temporomandibular joint disorders, occlusal issues, growth and development issues in children. So we as dentists have the ability to treat these kinds of problems because we can potentially provide for long-term solutions. In this program, we're going to have specialists that can relate the medical problem that we all know as airway into how we as dentists can manage this, and we can treat this in our own offices. The curriculum in this particular course is going to have Dr. Mary Burns, who is an orthodontist from Pennsylvania who happens to practice TMJ and occlusal principles in her own practice, and she is an airway specialist from an orthodontic standpoint. We also have Dr. Gerald Simmons coming in from Houston, Texas, who's a physician and neurologist who has a sleep clinic in Houston, Texas. He understands what we do in dentistry, and he's going to relate sleep studies and polysomnograms and how we can learn how to utilize those in dentistry and how dentists can manage sleep problems working with the medical community.